Okay, how many of you have gone to your doctor and they told you to stop working out because you're in pain? So in some cases, this is exactly what you need to do. With serious tissue damage, you do need to let whatever the body part is that's in pain heal and get some treatment on it. However, in majority of cases, and I'd say majority of people coming into my office, they do not need to stop working out because of their pain. They simply need to find activities they can do that are less painful. So treatment with that involves, so first of all, we want to figure out exactly where the pain's coming from and why it's occurring. So we want to figure out exactly if there's anything wrong with that specific body part, functionally and structurally. So we look at both of those. Next, we want to tone down the nervous system. So whatever pain you're having is an output of the brain. So if we can figure out how to stop that pain from happening, how to stop your brain from interpreting certain movements or certain movement patterns from pain, that's our first step in getting you out of pain. So let's say you're having pain with squatting. So anytime you squat, you have knee pain. Is there another position we can put you in that's similar to squatting that doesn't have pain? So when we do this, the brain starts to interpret squatting as less painful. So you may not have any structural damage while you squat, and it may not be causing any structural damage, just for some reason your brain is interpreting it as painful. In that case, we need to figure out a position, again, that's similar to squatting. So maybe we'll lay you on your back and we'll put you in the squat position, and we'll do that repetitively, and your brain starts to tone down the pain going to your knee because it figures out squatting's safe, it feels good in this position, there's no pain when doing it. We can stand you back up a lot of times and get you squatting pain-free. Now, depending on how long that takes and how much load we need, that's something we determine in the office. Next, we want to increase your threshold for pain. So once we get you out of pain, we want to increase your threshold for pain, meaning we want you to have a higher, a more tolerable body when you go back into the gym so that you don't experience that pain with the same exact activities you were doing before. We increase the threshold by addressing all the factors that are involved with your pain. So pain often can happen from tissue damage, it can often happen from poor movement patterns, it can happen because your diet's bad, maybe you have too much stress. So pain is multifactorial, so there's many different factors that go into your pain, and addressing your main ones are key to helping you get out of pain. So remember, if you're going to your doctor and they told you to stop working out because of your pain, there's usually another way to go about that. So we'd be happy to look at that in the office and get you back in the gym. All right.